Angiosarcoma is an oncological disease. Well, this picture shows that skin and scalp, CT, abdomen findings, PET scan. Look at this, and MRI to detect metastasis. Detail going on. Introduction. Angiosarcoma is a rare and aggressive form of cancer that originates in the endothelial cells lining blood vessels or lymphatic vessels. Though it can occur in any part of the body, it most commonly affects the skin, liver, breast, and soft tissues. This malignancy poses significant challenges due to its rapid progression and poor prognosis. Etymology. The term angiosarcoma is derived from the Greek words angio meaning vessel and sarox meaning flux, combined with the suffix oma meaning tumor. It refers to a malignant tumor originating in the cells lining blood or lymphatic vessels. A definition. Angiosarcoma is a malignant tumor derived from the endothelial cells of blood vessels or lymphatic vessels. It characterized by atypical, rapidly proliferating cells that form irregular vascular structures. Types 1. Cutaneous angiosarcoma typically affects the scalp and face, especially in elderly individuals. 2. Hepatic angiosarcoma originates in the liver and is often linked to exposure to certain chemicals. 3. Breast angiosarcoma can arise as a primary tumor or as a result of radiation therapy. 4. Cardiac angiosarcoma rarely occurs in the heart, often involving the right atrium. 5. Soft tissue angiosarcoma affects deep soft tissues such as muscles or connective tissues. Causes. The exact cause of angiosarcoma is unknown, but several factors contribute to its development. 1. Genetic mutations in endothelial cells. 2. Exposure to environmental toxins. Example, arsenic, vinyl chloride. 3. Chronic lymphedema. 4. History of radiation therapy. 5. Previous trauma or injury to the affected area. Risk factors. 1. Age. Most common in old adults. 2. Chronic lymphedema, often following surgery or radiation therapy. 3. Chemical exposure, arsenic, vinyl chloride, and thorium dioxide. 4. Radiation therapy, previous exposure for other cancers. 5. Genetic predisposition, mutations in TP53 or other tumor suppressors genes. Complications: 1. Local tissue destruction. 2. Metastasis to lung, liver, bones. 3. Hemorrhage or ulceration of lesions. 4. Cardiac complications in case of cardiac angiosarcoma. 5. Severe lymphedema. Pathophysiology: angiosarcoma arises from endothelial cells undergoing malignant transformation. These cells proliferate uncontrollably, forming irregular vascular channels. The tumor invades adjacent tissues and has a high propensity for hematogenous and lymphatic spread, leading to systemic metastasis. Pathophysiology of angiosarcoma, step by step process. 1. Initial triggers, genetic environmental factors. 2. Cellular dysregulation. 3. Angiogenesis and tumor formation. 4. Inversion into surrounding tissues. 5. Metastatic spread due to their vascular origin. Angiosarcomas have direct access to blood and lymphatic circulation, facilitating early and aggressive metastasis to distant organs like the liver, lungs, bone. 6. Local hypoxia and necrosis. 7. Immune system evasion. The tumor evades immune detection through mechanisms like upregulation of immune checkpoint proteins, example PD-L1, and creating an immunosuppressive microenvironment. This cascade results in the highly aggressive and often lethal behavior of angiosarcoma. Signs and symptoms. 1. Cutaneous angiosarcoma. Signs and symptoms: berries like lesions or purple patches, nodular masses, ulceration and bleeding. Vascular angiosarcoma, pain in the affected organ, weight loss and fatigue. In organ dysfunctions, example jaundice in hepatic involvement. 3. General symptoms fever, night sweats, anemia, or diagnosis. 1. Clinical examination, initial assessment of lesion or symptoms. 2. Imaging studies, MRI and CT scan to evaluate the extent and spread. PET scan to detect metastasis. 3. Biopsy, histopathological examination confirms diagnosis. 4. Laboratory tests, blood test for liver function if hepatic involvement, tumor markers. 5. Lymphangiography for lymphatic involvement. Nursing diagnosis. 1. Acute pain related to tumor growth and metastasis. 2. Risk of infection related to immunosuppression. 3. Impaired skin integrity related to lesions or radiation therapy. 4. Anxiety related to disease prognosis. 5. Risk for ineffective coping related to a life threatening illness. Management. First, medical management. 1. Surgery, primary option for localized tumors. 2. Radiation therapy, used post surgery or for inoperable tumors. 3. Chemotherapy, agents like paclitaxel and doxorubicin for systemic disease. 4. Targeted therapy, drugs targeting VEGF, vascular endothelial growth factor. Nursing management. 1. Pain management, administer prescribed analgesics and non-pharmacologic interventions. 2. Skin care, prevent breakdown in areas affected by lesions or radiation. 3. Psychological support, provide emotional support and counseling. 4. Monitoring, regularly assess for signs of metastasis or complications. 5. Patient education, teach about treatment regimes and self-care strategies. Treatment options. 1. Surgical decision, complete removal of localized tumors. 2. Chemotherapy for advanced or metastatic disease. 3. Immunotherapy, emerging treatments using immune checkpoint inhibitors. 4. Radiation, often combined with surgery for better outcomes. Psychosocial medicine. 1. Counseling, address emotional and psychological distress. 2. Support groups, connect patients with others facing similar challenges. 3. Family education, help families understand and cope with disease. For stress management techniques, encourage relaxation methods like meditation. 5 social work assistants provide resources for financial and logistical support. Prevention 1. Minimize exposure to known carcinogens, example arsenic, vinyl chloride. 2. Early management of chronic lymphedema. 3. Regular screening for individuals at high risk, example post radiation therapy patients. 4. Promote healthy lifestyle choices to enhance overall immunity. In conclusion, angiosarcoma, though rare, is a life-threatening malignancy requiring a multidisciplinary approach for effective management. Early diagnosis, prompt treatment, and comprehensive care can improve outcomes and enhance the quality of life for affected individuals. Advances in research and targeted therapies often hope for better prognosis in the future. Thank you. Have a nice day.